What is tomotherapy? So tomotherapy is a type of radiotherapy and it uses gamma rays, also called X-rays. So these are high frequency radio waves, and the radio waves bring energy to the tumours. They damage the cells in the tumours. The way it works is the radiation knocks electrons off, I think primarily the oxygen atoms in the cancer cells. These form ions, and these cause the cells to be damaged. Some of the cells die, others are damaged and then killed by the immune system that recognizes them as damaged cells. So tomotherapy is a gantry-based radiotherapy, which means you're in a ring essentially. So you put on a treatment table and there's a large ring, and the beam device is in the ring, so it can move around and shoot the tumor from various angles. I think also with tomotherapy there's actually many beam devices in the ring, so lots of low intensity beams are being used, and this allows the more of the energy to be focused on the tumor, and this should cause less damage to healthy tissue. Because it's gantry style, as a patient you sort of lie back and relax and the machine kind of moves around you. So if several targets are being used, you may not need to be repositioned, which means the treatment session is shorter. Now, if tomotherapy, you're generally going to be doing quite a few treatment sessions. When I had tomotherapy treatment for a lung tumor, I think it was 20 sessions. The sessions are called fractions, because it's like you are receiving a total radiation dose divided into fractions. And this is done for a couple of reasons. One is safety, just having less radiation at once. Another reason is that you get time for the healthy tissue to self-repair. Another reason is that the cells are generally going to be dying in the cell cycle, and therefore if you have the treatment spread over many fractions, there's a more chance that the radiation will sort of damage the cells at the right time when the cell cycle is happening. Now, the healthiest cells shouldn't be in the cell cycle. If you're an adult, your healthy cells are not like growing and dividing and multiplying, except of course skin cells, hair follicles, nails, all those kind of places. So if those are getting radiation dosed, then yeah, there can be some damage there. Tomotherapy is quite a few years old now, pretty widely available, and yeah, I've had it quite a few times for lung tumor, liver tumors, and some lymph node tumors. Yeah, I had no noticeable side effects, although there are still side effects, as in damage to your body that you might not be aware of. Radiotherapy causes bone marrow suppression. Bone marrow is kind of important as it's where our blood is made, and I think white blood cells also made in the bone marrow, or yeah, most of them are made in the bone marrow. Yeah, very important. And bone marrow suppression is an issue because, for example, you can't really do radiotherapy that causes bone marrow suppression at the same time as a chemotherapy that causes severe bone marrow suppression, it would be too much. Yeah, and radiotherapy will also cause weakening of bones if the target has to like go through a rib. You can get osteoporosis. I don't know if that's associated with tomotherapy specifically. But yeah, so even though I had no noticeable side effects at all from tomotherapy, it still does damage your body inside. So you do need to consider that when making a treatment decision.